This is Rainer Hoyn. I'm a consultant psychiatrist, professor of psychiatry, and editor of Global Psychiatry Archives. This is an unusual paper because it's just the paper about the planned implementation of psychosocial interventions for patients with psychotic disorders in low and middle income countries. And it's a protocol for hybrid effectiveness implementation cluster randomized clinical trial. So sounds quite difficult. The team is partly from London University, but also from different countries in the Eastern Europe. So this is a large study, and they're trying to do a multi-country pragmatic approach. What they do is they train 80 clinicians, and every clinician has 5 patients. Some of the patients are trained in this new device, and the new device is called DIALOG. And the idea is that this should structure the clinical interview. So the intervention is more or less 6 times over 12 months during normal routine meetings. And the intervention is, I come back to that, but in principle is a structured interview which is guided by an app. The outcome measures are quality of life, so the Manchester assessment of quality of life. Other outcomes are the brief psychiatric rating scale, the clinical assessment, the interview for negative symptoms, brief symptom inventory, satisfaction with services, and they will also assess the economic costs at the 12 months. Right, okay. So this study then hopes to see whether this intervention, which is a structured designed interview and planned intervention in one go. So I'll just show you in a minute how it should look like. So this is the key components of the app, which is called Dialog Plus. So first is, it should be it's more or less a structured assessment of life domains. So the patient and the doctor can hold the computer and go through different life domains, and then trying to focus on an approach. And they just try to compare current and previous outcomes. So the whole process is a clinical assessment with technology assistance. And then they've tried to have a solution-focused approach. The patient who can also assessed. And then there will be self-reflection, which will be had with this computer-based. The outcome should be reduced psychotic symptoms, that's a hope, reduced treatment costs, improved social outcomes, and improved quality of life, which is more or less what we want in most cases. So, but the main difference is it's structured, and it's structured with the help of an app. Right. So this is all well trained, and this has been done and pre-tested in different places. The other maybe important thing is it's not just for doctors, it's also for other clinicians who work with mental health patients. Right, and so the enrollment was more or less, so clinicians were assessed first. They have to have interest, being doctors, nurses, and have experience in mental health. Patients should then be assessed, people who have no mental health problems or no schizophrenia. Then they have baseline assessment, and then one group had this intervention, and the patients had all these 6 assessments, and then a final assessment, and then the analysis. And the control group consists of people having 6 assessments, but clinically without any intervention with this app. Right, okay, so then there's assessment, and this is a plan. The study hasn't been performed, but as we can see now, it's more common that people are required, or authors are required to publish pre-study plans, which is good practice, because at the end of the day, then studies would not deviate from what they intend to, and they can properly describe what they expect to do. So these are, again, the clinicians' criteria, so professional qualifications. They shouldn't plan to leave the jobs. So then you have people with psychosis, currently in remission, so it's just it's more or less outpatients, clinics, patients, what you expect, and they should have no plans to leave the area, and should be able to provide informed consent, and shouldn't have any organic brain disorder, and they should be cognitively fine. Right, so then we'll be blinded, people will be trained, the different settings. So I just say Bosnia, Herzegovina, Kosovo, Republic of Macedonia, Montenegro, and Serbia are areas where people will be included. So that's the study. I told about the control group, and then there is an implementation group who supervises all this. And the idea is that eventually everything will be more efficient. Quality of life is an important outcome. And then there will be different health assessment. Right, okay, so this is where we are at the moment, and there will be enrollment of people, allocation, and post-allocation, which is a follow-up of the services as well of the patients. And this will be related, and then when we check what type of outcome has been working, and there will be also health economic assessments, which I'm not an expert of. Anyway, so if you're interested, please read the paper on www.globalpsychiatry.co.uk. If you want to publish with us, please again look at the same website for authors' instructions. If you want to get some information as such we provided here, I think that's important. And I would wish if you could subscribe to our channel, and I wish you a nice evening. Thanks for listening, and have a good evening. Goodbye.